The Newborn Screening Program, or NBS, is a public health initiative that detects hidden congenital disorders among apparently healthy newborns. Early detection saves lives by preventing complications that lead to lifelong disabilities or even death. This program is a vital part of the Department of Health's Maternal and Child Health Services, ensuring that every Filipino child gets a healthy start in life. The newborn screening program is designed for early detection of congenital disorders. These are conditions that might not be visible at birth but can cause severe damage if left untreated. NBS helps identify healthy looking babies with hidden diseases, allowing physicians and nurses to intervene before symptoms appear. It is one of the key preventive measures that strengthen the nation's maternal and child health outcomes. Newborn screening is mandatory by Republic Act 9288, also known as the Newborn Screening Act of 2004. This law requires all health facilities, whether public or private, to offer newborn screening before the baby is discharged. The law ensures timely detection and management of metabolic and genetic disorders that could lead to mental retardation or death if not addressed early. Complications with this law are prevented, and compliance is not optional. Newborn screening is a standard of care. The newborn screening program has three primary objectives. One is to detect disorders before symptoms appear, allowing for early treatment. Two, prevent mental retardation, physical disability, or death due to undiagnosed conditions. Three, promote normal growth and development through early and continuous management. As nurses, our role is to ensure that screening is done on time and that parents understand its significance and importance. The target beneficiaries are all Filipino newborns, regardless of where they are born, in the hospital, in birthing clinics, lying ins, or even the home. The ideal time for testing is 24 to 72 hours after birth. This allows enough feeding time to detect metabolic conditions accurately. For home births, midwives and nurses should refer the baby to the nearest facility or newborn screening center to ensure they don't miss the window for testing. Early detection truly makes the difference. When disorders are identified early, babies can grow and develop normally. But if diagnosis is delayed, irreversible damage such as mental retardation, organ failure, or death can occur. Prevention through screening is also far more cost effective than lifelong treatment and rehabilitation. Simply put, early screening means a lifetime of possibilities for every child. The screening process follows three key steps. First is blood collection. A few drops of blood are obtained through a heel prick and blotted on a special filter paper card. Next is laboratory testing. The sample is sent to a newborn screening center or NSC for laboratory analysis. Third is the release of the result. The results are returned to the health facility and communicated to the parents. Nurses must ensure that samples are properly labeled, stored, and transported to maintain integrity. Here are some key procedural guidelines. Perform the test after 24 hours of feeding when metabolic processes are stable. If the test is done earlier, repeat the screening after 7 days to confirm accuracy. Third is to follow strict infection control and labeling protocols to avoid contamination or mix ups. Remember, accuracy and timing are both critical for a valid results. When the program began, it screened for three core disorders: the congenital hypothyroidism. This condition leads to mental retardation if not treated. Another condition is the congenital adrenal hyperplasia. This condition causes hormonal imbalance and life threatening salt loss. The third was phenylketonuria or PKU, which affects brain development due to inability to process phenylalanine. Detecting these conditions prevent irreversible development damage. Later, two more conditions were added, forming the original five test panel. We have galactosemia. This is a milk sugar metabolism disorder that causes liver and brain damage. And we have the G6PD deficiency, a red blood cell enzyme defect that can cause anemia or jaundice. These five became the foundation of the Philippine Newborn Screening Program. In 2014, the expanded newborn screening was introduced. It now covers more than 20 conditions, including organic acidemias, fatty acid oxidation defects, and various blood and metabolic disorders. ENBS offers a more comprehensive look at a newborn's health and allows interventions for rare but serious diseases that once went undetected. Results are classified as normal or positive. A normal result means the baby does not have any of the screened disorders. A positive result means further confirmatory tests are needed. Nurses play an important role in explaining results and guiding families through the next steps, reducing anxiety while ensuring timely referrals. For babies with positive results, they are referred to continuity clinics for confirmatory testing and management. Treatment may include special medications, dietary adjustments, or hormone therapy. Continuous monitoring and family education help ensure long term adherence and better outcomes. Nurses coordinate these referrals and help families understand follow up instructions clearly. Our role as nurses are central to the success of the NBS program. We first educate parents about the purpose and benefits of screening. We collect and handle specimens properly following DOH procedures. And we record and report results accurately for documentation and tracking. Our role combines technical skills with communication and advocacy for child health. In implementing newborn screening, nurses must observe ethical and legal standards, obtain informed consent from parents before performing the test, maintain confidentiality and accuracy of results to protect family privacy, strictly comply and adhere with DOH policy and guidelines, and of course, the Republic Act 9288. These practices uphold the rights of the child and strengthen professional accountability. The newborn screening program is managed collaboratively by the Department of Health, the National Institute of Health, and the Newborn Screening Reference Center. These agencies oversee regional laboratories which support hospitals and clinics across the country. Regular quality checks ensure that testing and reporting remain consistent and reliable nationwide. Let us look at how success is measured. 95% coverage rate shows that most newborns are now screened before discharge. 80% reduction in disabilities from metabolic diseases proves early detection works. The program is recognized internationally as a model for effective preventive health care. These milestones show how nursing and the community efforts can truly transform public health outcomes. Despite its success, the program still faces several challenges. There's still limited access to testing in remote or far flung areas. There is still low awareness among some parents and birth attendants. A continuing need for training and advocacy to sustain a quality implementation. Overcoming these challenges will require teamwork among nurses, health facilities, and the local government. To summarize, newborn screening saves lives through early detection and intervention. Nurses play a crucial role in advocating for the screening, and in educating parents, in collecting accurate specimens, and ensuring that every baby is screened. Do not forget that every newborn deserves the chance to live a healthy and fulfilling life. By advocating for timely screening, we help make that possible.